In this final section, we look at what the evidence suggests with regards to clinical outcomes when treating these conditions with shockwave therapy. Where the evidence is strong. For plantar fasciopathy, high-quality evidence reports that radial shockwave therapy is effective for chronic plantar fasciopathy, especially when other conservative measures have failed. Multiple randomized control trials and meta-analyses show significant pain reduction and functional improvement superior to placebo or sham treatments. This treatment is recommended by NICE guidelines as an adjunct to rehabilitation and orthotics. Example evidence: Gerdes-Meyer et al. 2008 showed significant improvements versus placebo at 12 weeks and 12 months. Orhan et al. In 2023 showed radial shockwave therapy provided superior 6-month outcomes in their randomized control trial, which explored radial shockwave therapy versus corticosteroid injection versus kinesiotaping. Cortez-Perez et al. In 2024, their systematic review and meta-analysis showed shockwave therapy more effective than corticosteroid injection for pain and function. Tung et al. In 2025, their updated meta-analysis found shockwave outperformed several conservative modalities for plantar fasciopathy. Calcific shoulder tendonitis. The evidence quality is again high for shockwave therapy overall, with good results for radial shockwave therapy in mild to moderate cases. The evidence says that radial shockwave therapy is effective for breaking down calcium deposits and reducing shoulder pain and dysfunction. Focus shockwave is often preferred for deeper or large deposits, but radial shockwave therapy works well for superficial calcifications and general tendon irritation. Significant improvements compared to placebo and some steroid injections have been reported. Example evidence: Su et al. In 2008, Lopolo et al. In 2012, their meta-analysis show large improvements in function and radiographic calcium resorption. Zhu et al. In 2024, their systematic review and meta-analysis of shockwave therapy and rotator cuff disease includes and supports trials with radial devices. Where the evidence is moderate. Achilles tendinopathy. Here the evidence says that radial shockwave therapy is good for chronic mid-portion Achilles tendinopathy, especially alongside eccentric loading programs. The treatment works well for insertional Achilles tendinopathy issues too. Radial shockwave therapy provides additional pain reduction compared to exercise alone. Example of the evidence includes Romp et al. In 2008, who showed that radial shockwave therapy and eccentric exercises perform significantly better than eccentric loading alone at 16 weeks. Tennis elbow. The evidence says that radial shockwave therapy is good for chronic cases of 6 months duration or longer, especially when it has been resistant to other physiotherapy treatments. It is reported to be better than placebo, but not always better than structured exercise alone. A combination works best. The evidence is mixed with regards to effects on short-term pain improvements, but the evidence is positive for improving long-term function. Examples of the evidence include Romp et al. With multiple studies between 1996 and 2009, suggesting small to moderate benefit over placebo at 3 to 6 months. Takanaga et al. In 2022 showed shockwave therapy among effective options for pain and grip strength. Patella tendinopathy. There is good support for chronic cases, especially when combined with rehabilitation. Short-term improvement shown in pain and function. Example evidence: Zwerver et al. In 2011, positive but modest effects, more pronounced when combined with physiotherapy. When reviewing the evidence, it is important to critically appraise the research and respect potential study limitations, including small sample sizes, short follow-up periods, and inconsistent protocols, along with placebo effects and concurrent therapies which can confound the results. But to summarize, radial shockwave therapy is a safe, evidence-based treatment for chronic musculoskeletal conditions. It stimulates healing, reduces pain, and improves function. With proper patient selection and technique, it can be a game changer in clinical practice. Here is a list of trusted, practical, and research-focused resources a UK therapist can use to stay up to date on radial shockwave therapy. They are the International Society for Medical Shockwave Treatment, the British Shockwave Association, and NICE. Journals like the British Journal of Sports Medicine and Journal of Orthopaedic and Sports Physical Therapy regularly publish shockwave therapy research. And here are the references for some useful research articles that may be of interest, and they also provide a useful starting point for further reading. Thank you for your attention. If you are considering adding shockwave therapy to your clinic, please get in touch with the team at Eureka, who will be happy to discuss device options and implementation strategies.